In one tiny red thread, you get aroma, color, and centuries of human use. This is saffron, Crocus sativus L. Widely known as a culinary spice, saffron has also been examined in scientific literature for its chemical composition and its effects on various biological markers in human studies. This video reviews what has been observed in peer-reviewed research, where evidence is limited, and why dose, formulation, and safety boundaries matter. Historically, saffron appeared in traditional medical writings across Persia, India, and the Mediterranean. These texts described its use in cultural and wellness practices related to mood, discomfort, and women's health. It is important to note that traditional use does not establish clinical effectiveness. Modern interest in saffron comes from laboratory analysis and controlled human studies that attempt to evaluate these historical observations using contemporary research methods. Researchers have identified several compounds in saffron that are commonly discussed in the literature. Crocin and quercetin, carotenoid pigments associated with color. Saffronal, a volatile compound responsible for aroma. Picrocrocin, contributing to taste. These constituents are studied for their interactions with oxidative pathways, neurotransmitter signaling, and inflammatory markers. Such mechanisms help explain why saffron is explored across multiple research areas, though mechanistic findings do not equal clinical outcomes. Mood-related outcomes, observed associations. Several randomized controlled trials and meta-analyses have examined standardized saffron extracts in relation to mood-related questionnaire scores in adults. Across short-term studies, doses typically ranging from 30 to 50 milligrams per day were associated with changes in standardized depression and anxiety scales when compared with placebo. Some trials reported outcomes may be clinically significant. However, study populations were limited, follow-up periods were short, extracts were standardized, and may not represent retail products. These findings should be interpreted as research observations, not evidence of treatment or prevention of mental health conditions. Women's health research, limited clinical data. Clinical studies have evaluated saffron supplementation in relation to premenstrual symptom questionnaires. In some trials using approximately 30 milligrams per day, participants reported reductions in selected PMS-related symptom scores. Reported side effects were generally mild, including headache and appetite changes. Saffron has also been examined in small studies evaluating female sexual well-being questionnaires, where some participants reported changes in desire and satisfaction compared with placebo. These findings are not diagnostic or therapeutic claims, and results vary between studies. Men's sexual health studies, exploratory findings. Research involving male participants has explored saffron in the context of sexual function questionnaires, including studies related to antidepressant-associated sexual symptoms. Some trials reported improvements in self-reported measures of erectile function and satisfaction. However, results regarding reproductive parameters such as semen quality are inconsistent and evidence remains preliminary. No conclusions can be drawn regarding fertility or medical treatment. Metabolic and cardiovascular markers. Adjunct research only. Systematic reviews and randomized trials have investigated saffron in relation to laboratory markers such as total cholesterol, triglycerides, blood pressure, glucose parameters. Observed effects were modest and variable, and saffron was studied as an adjunct to standard care, not a substitute. These findings reflect biomarker observations, not disease management. Safety and dose considerations. Across human studies, saffron extracts used at approximately 1450 milligrams per day were generally well tolerated. Commonly reported effects included nausea, dry mouth, decreased appetite, headache. Toxicology literature indicates clear upper limit concerns at high intakes. Doses in the gram range may be harmful. Extremely high intakes have been associated with serious adverse effects. Higher dose studies, 200 to 400 milligrams a day, have reported laboratory changes involving platelet counts and kidney markers, reinforcing the importance of dose awareness and medical supervision. Pregnancy and special populations. Pregnancy is considered a high-risk category. Both historical records and modern reviews indicate that large amounts of saffron may be associated with uterine effects and pregnancy complications. For this reason, non-medical saffron supplementation is generally not recommended during pregnancy. Consumer education, non-directive. When discussing saffron products in general, Product composition varies widely. Clinical studies typically use standardized extracts, not culinary quantities. Higher doses do not equate to greater benefit. Saffron should not be viewed as a substitute for prescribed therapies or professional care. Saffron illustrates how traditional substances can become subjects of modern scientific inquiry. Current evidence shows measured, context-specific research signals, not universal effects. Understanding dose, formulation, and safety limits is essential when interpreting supplement research. If you like our content, please like, share, and subscribe to get more similar contents. This video is for educational purposes only. It does not diagnose, treat, cure, or prevent any disease. Saffron and saffron-containing supplements are not approved by the US FDA for medical use. Always consult a qualified healthcare professional before using dietary supplements, especially if pregnant or taking prescription medications.